What if your body could heal itself without surgery, painkillers, or endless rehab? Well, today we've got a good friend of mine. His name is Dr. Tim Rindlisbacher, and he's a top sports physician who's worked with some of the best professional athletes in the world. We're going to break down PRP Therapy, Cartilage Regeneration, and stem cells. Do they actually work? What are they? Who should consider them? And are they actually worth the hype? Now, when I sent Dr. Tim a list of topics, this was the one that really jumped out to him. And he was fired up to talk about it. And after our conversation that we had, you're going to see why. Why is that a topic or an area that you find so much interest in?
It's topical because it's one of the new kids on the block in terms of managing chronic conditions and acute conditions as well. Obviously, it's a big issue in elite sport care. And I think it needs to be explored further. So it's a really good topic to cover today.
And I feel like with regenerative medicine, it almost sounds like something that's out of a sci-fi film. So what exactly is this large topic of regenerative medicine? And can you kind of break it down for the average person to kind of help them understand what that actually means?
Yeah. I mean, isn't it cool to think that if you tear something or if it's falling apart because of age and use, that you can possibly regenerate that tissue and make it normal again. I think it's a little bit of the fountain of youth concept.
Right.
But yeah, that's kind of what it comes down to.
And so is this something that is this almost like a game changer for the field of medicine? Kind of where does it fit in terms of, the importance of where it fits into medicine as a whole?
Great question. I think the proponents of it, the strong proponents of it, would love to think that it's a game changer. We are seeing more and more what it can do, but also what its limitations are. And so I'm sure we'll get to that in more detail later, but it's not a panacea by any means. We are learning to use it better and better, but we're also realizing where it does not work.
Right. And so as a doctor who's worked with, high level elite athletes and now you work with a lot more of kind of, general population and still with athletes as well, right? And so as a physician, where do you fit in with regenerative medicine? Kind of what's the role of a doctor with, prescribing and figuring out whether or not regenerative medicine in whatever form, which we'll kind of cover a couple different forms today, how do you kind of fit into that equation?
It varies. Sometimes the patient, usually the elite athlete, is walking in the office telling me, I need this. My buddy had this, my teammate had this, and I'm going to get this. Help me find this solution this way. In other cases, it's me trying to investigate different solutions, and when something's not working, it's still my responsibility ethically to find an answer for that patient, to get them the care they need. And in those cases, that's the more common time that I will be presenting a regenerative option.
Right. And so when somebody, walks into your office and they're like, okay, I need this is what I'm looking for. I feel like in the realm of health, I do it myself too, where I kind of self-prescribe. Okay, this is my issue. This is the problem. This is what I need. So how does that, I guess, does it have an influence on which direction you go, or is it kind of the same thing you need to do, whatever steps you need to go through in order to figure out exactly what the root cause actually is, and how do you convey that to somebody who's almost already kind of said to themselves, this is what I need?
I believe in patient-centered care. I think that somebody requesting a specific treatment, as long as they understand the risks and the benefits, I'm going to try to help them get that. It may not be what I recommend, but if that's what they're bound and determined to get, then I can try to help them achieve that.
And so one of the big, I guess, treatment or areas in regenerative medicine is platelet-rich plasma, PRP. So what does that even mean?
your blood, when broken down into its components based on centrifuging it, so if you spin the blood, the heavy stuff is the iron. That makes sense. So the red blood cells will go to the bottom of the tube, and the liquid stays at the top of the tube. And somewhere in the middle is what we call a buffy coat. And that buffy coat is full of platelets, which is another cellular element of their blood, as well as some growth factors and other bits. So it's kind of the good stuff that we siphon off, and we take that component of the spun blood and we inject that into the tissue that's needing help.
Right. And so I guess the different components of the blood are separated, and platelets, that's the kind of the regenerative part, and that's kind of where it fits into the regenerative medicine conversation.
That's correct. Platelets and growth factors that are in that buffy coat. Correct.
And so where, in your opinion, where did all this talk about regenerative medicine, kind of how did that all come about? Because I feel like that's something that has really not necessarily exploded, but it has grown in interest for a lot of people, within the last, 5, 10, you've been doing this for a long time. So you tell me kind of how did this all come about, and why is it kind of really emerging, especially lately?
Yeah, actually dentists started using it in the 70s. They were the first ones to try to use it. And I'm not exactly sure what they were using it for back then, but it was felt to be helpful. So there are some anti-inflammatory effects as well as the regenerative component to PRP, and that's sometimes the reason I actually support it, is because I think someone needs an anti-inflammatory effect, and cortisone may actually cause them harm. So this is often the conversation with the elite athlete, is they don't care about the price. I'm sure we'll get to that shortly. They don't care about the price. Is this going to harm me? No. Could it help me? Maybe. And so they're like, well, why wouldn't I get that then? My teammate had it, blah, 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 all that stuff I mentioned before. So there's kind of a no downside really to this stuff other than the cost. And they got lots of money, so they don't care. But so that's really the essence of this whole regenerative world, whether it's stem cells, PRP, hyaluronic acid is not exactly regenerative in some ways, but that's kind of the essence of the discussion.
Right. And I think you bring up a really good point, because when it comes to, and I've got a little bit of a story here, actually. I remember when I was about 13 or 14, I had a family doctor. Their name was Dr. Arthur up in Collingwood. And at the time, I was very, very into baseball. I grew up playing baseball. I wanted to be a pro baseball player. You can see it didn't work out. But at one point, she had told me that it was either golfer's elbow or tennis elbow. And, as somebody who, grew up playing baseball and that was my dream, I heard that and I was like, oh, that's the end. I'm done playing baseball. And I was worried, and I was, I upset myself sick. Right. And that doctor, what she did really, really well was that she really broke down what that actually meant and gave me that, she gave me the peace of mind to kind of feel hope with after that wasn't the end. Right. And that's one of the things I appreciate a lot with, the clients that I know that you've worked with, some of my clients as well, is that they leave with hope versus being like, okay, that's it. That's the end of it. Right. And I feel like, and correct me if I'm wrong, but regenerative medicine can be one of those avenues that people can go down before they, have to get a surgery or something like that. So is that another area where regenerative medicine can kind of fall into, is kind of not necessarily that last ditch effort, but kind of giving somebody hope to try something else before going down a more serious path, I guess.
Yeah, that's a great way of putting it. Unfortunately, some of my colleagues, I think, lean a little more toward giving people hope where there probably isn't much hope, but they now have all the PRP equipment, for example. And what is the phrase, when you have a hammer, everything starts looking like a nail?
Right.
So there's that hope, and especially the elite athlete or the or the really determined injured person has a bit of a desperation, almost like a cancer patient. I don't want to use that analogy too loosely, but where they're giving them that hope, they're like, they'll buy into that for sure. Like they don't care, mortgage the house kind of thing. And it's a little unfortunate, because what they should be doing is looking at the research and saying, based on this study, you will do well with this intervention. And unfortunately, it's either hype or desperation or that, giving them that hope that drives the intervention.
Right. And so with PRP specifically, is there a type of injury or a type of or a part of the body where it typically responds better to PRP, tendons or a muscle? Where does PRP fit in for, regeneration of those different tissues, and which ones kind of respond best to it?
That's a good segue to talking about the research, because you can have quality evidence that shows that something works, but you can also have quality evidence, meaning well-done studies, large numbers, no bias, all that sort of thing. Quality evidence that shows that something doesn't work. So you can have a positive effect or a negative effect. And so the only quality evidence we have for PRP is that it doesn't work for chronic Achilles tendonitis.
Right,
Okay,
that's it.
I'm being very specific, because that's how specific you have to get with these things, unfortunately. So when you say which tissue, the question is, yes, which tissue are we talking about?
Right.
So there's lots of studies on osteoarthritis, especially of the knee, for PRP, and there are many studies that show that it works. When you pool it all together, is it quality evidence? Not really. It's got these wide sort of doubtful areas, and the bias that's injected into some of the studies makes it hard to interpret the data. So that's become a real challenge with PRP, or any injection research for that matter. I think we maybe talked about this before, but there's a 30% placebo effect with any needle. So if I stick a needle into a body part, don't do anything, don't inject anything, 30% of the people will say they got better.
Wow.
So if you're going to show a treatment effect, you have to go show beyond 30%. And so it makes the studies, all of these injection studies, really difficult. And especially you tell them that you're going to take out this really important part of their blood, and that's the part that's going into the tissue where they're feeling pain, and they're paying big bucks for it. All of those things lend themselves toward a placebo effect.
Right. And that makes it really hard to get quality research
get quality
as well.
evidence. Exactly. Yeah.
Right. And so if somebody is getting this PRP done, they say, okay, you know what, I want to spend money. I want to test this out. I want to, even if it can help me a little bit, even if I get that 30% placebo effect and they feel better, what kind of things go into, getting that done? Is it something where I was doing a little bit of research on my own before this, actually, and it was something about the NSAIDs, right, and going off of them before doing PRP. Why is that a thing? And if so, why does that matter?
It depends on the scenario. It's felt that if you dig even deeper to PRP research, there's something called leukocyte rich and leukocyte poor PRP. So basically, so that again clouds the waters when you're doing research, because they'll say, oh, well, that study showed it didn't work, but you didn't use leukocyte rich PRP. So leukocytes are white blood cells. And so when there are lots of white blood cells mixed in with that PRP, those seem to be better with inflammatory conditions. So if the condition is very angry and inflamed, the experts of PRP will tend to use a white blood cell rich option.
Right. And so I kind of want to go back to the quality studies for a second. And I feel like with lots of different areas of health, getting the quality study is tough to do. There's a lot of work that goes into getting a high quality study, done, right? Both financially to get it done, all the logistics involved behind it. And so when it comes to PRP, it sounds like it's an area that's kind of emerging a little bit more. There are more studies being done about it, but I guess I want to kind of hear your, final thoughts on that before we move into the next regenerative medicine topic on it. It sounds like it's an area that needs more research, but it's on its way. What do you think?
Yeah, the Cole's notes on research is basically there's randomization. So when you have 200 people in the study, how did those 100 get into that arm of the study, get that treatment? How did the other arm, the other 100 get the placebo treatment? So it has to be randomized. It's not someone saying, oh, they seem younger, or they seem this, or they seem that. We're going to put them in that study. They seem more motivated to do their exercises. We'll get to that as well later. So randomized, blinded is very quick, means you don't know what treatment you got, and the person assessing you also doesn't know what you. So randomized, double-blinded, that's what that means, double. And controlled means there's a solid control, solid comparison. So this group got PRP, this group got cortisone, and this group got saline, or a true placebo injection. So that's all of the good studies have to have at least that. And there has to be no bias in terms of each of those interventions or elements.
Right. And then, so you spoke a little bit earlier about the kind of like knee injuries or knee issues, right? And so when it comes to cartilage regeneration, I know that cartilage is an area that is a little bit tougher to heal, right, with the lack of blood supply and whatnot. But where does regenerative medicine fit into that equation? With, let's just same thing, use an example of joint cartilage or something like that. Where does regenerative medicine fit into that?
Yeah, it's probably the number one area, just because it's so common. It's the number one area where this regenerative medicine is used. And so in all of our joints, there is this degradation and regeneration going on, all of us at this moment, in each of our joints. And when you start losing that battle, the degeneration is tipping the scale toward its side, then that's when you start to get thinning of the cartilage and fissuring, so cracks in the cartilage. You start sloughing off pieces of the cartilage, and as you pointed out accurately, there's not a consistent blood supply per se. And so regenerative medicine and even hyaluronic acid is looking to shift that balance of degradation versus generation.
Right. And so what was it called?
Hyaluronic acid.
Hyaluronic acid.
Right.
And so for somebody who's dealing with something, let's say, osteoarthritis in, knee or wherever it is, what exactly is hyaluronic acid, and how could that help if it does?
So we have better quality evidence and many more years of looking at hyaluronic acid as a treatment for osteoarthritis, for example. That's the most common intervention, most common application. So can it be regenerative? We're not sure, but slowing the degradation is sometimes as good or just as good or close to regenerating. So we don't see the things popping up, but we see symptoms not getting worse. We see symptoms for 6 to 12 months being much more improved, and then there's the inevitable degradation of the joint that eventually happens, but we can hold off knee surgeries, joint replacement surgeries, and other problems. Allow the patient to be more active during those years. It's a good intervention in my opinion, but again, not perfect evidence. We don't have a plethora of quality evidence for hyaluronic acid.
Right. And I feel like at a certain age, if somebody's in their 60s, 70s, even 80s, eventually it does get to the point where it's about slowing the decline, whether it's physical with joint issues, loss of muscle strength, even neurological, whatever we can do to slow any of that decline is in my opinion, a massive win, right? Especially when it comes to things like staying independent at home or quality of life, right? I mean, by slowing the decline of different degradation of tissues and whatnot, that might mean that you can stay independent for an extra, I'm just going to throw out random numbers, I've got no science behind this, but 2, 5, even 6, 7, 8, 9, 10 years down the road, right?
Sure. Absolutely.
So when it comes to hyaluronic acid. Is there any other kind of modalities or treatments that are kind of packed together in the same boat with that sort of treatment?
There are different formulations. So hyaluronic acid, just like PRP, has subsets. And so some have a higher molecular weight, which is felt to stay in the joint longer and have a better effect. Other hyaluronic acids are cross-linked, so the molecules themselves are sort of linked. And that, again, seems to be, there's some decent evidence now that's showing those formulations are a little better. There's even one that comes with a steroid. So it has cortisone mixed in with a type of cortisone mixed in with the hyaluronic acid. So you get that quick anti-inflammatory bump at the beginning, and then that several month benefit later on.
Right. And so we've talked PRP, we've talked the cartilage regeneration with the hyaluronic acid, but one other thing that I really wanted to cover today is stem cells, right? And I feel like that's one of the big ones where everybody's saying, well, you can do stem cells for this, stem cells for that. And so what exactly is this whole stem cell hype all about?
Sure. So stem cells are basically immature cells that haven't yet stemmed out to one type of tissue or another. So they are called potential cells, or some are pluripotent, meaning they've got multiple different potentials to become cartilage tissue versus bone versus connective tissue like ligaments and that sort of thing. So you can take we all have stem cells in our bodies. The sources where stem cells can be derived from are your fat. So in your fat cells, there are stem cells. In your bone marrow, it's probably better quality, lots of stem cells there. And you can even take it from the umbilical cords of pregnant ladies, or ladies that just gave birth, I should say. There are stem cells that are not your own. They're from the cord. So lots of options in terms of stem cells, and those can be treated as well. Those can be manipulated in certain ways and injected into the area where you're trying to regenerate. So Health Canada, about 8 years ago now, I think, said this is getting this is getting out of hand. There are a lot of clinics that are doing these stem cell injections for various things, and we don't know about safety profiles. Could they be unlocking little cancers that we have in our bodies? Are they stimulating problems we don't want to create? So stop it. Or if you want to do stem cells, it has to be part of a research study. That's the only way you can get stem cells in Canada currently.
Right. And so does it differ in places like the U.S. and stuff? Because there's something I saw, and I don't know what your thoughts on that. I think it was something to do with the umbilical cord, and it was banking of these stem cells. So what is that? That's storage of these
differentiated.
Right, undifferentiated cells. What's that whole thing about?
Yeah, so the U.S., their perspective about 8 years ago as well was, no, you can keep doing it, but we're going to give you a few years to get your research together. So it was a slightly different approach. And then other countries, it's the Wild West. You can get any kind of stem cell you want if you're willing to pay for it. There's lots of different options. So there's been some banking of stem cells. It's really a broad area, and you can really go down the rabbit hole if you start searching this stuff on Google for sure. But it's even less known than the PRP in terms of research, because again, what are you going to compare it to? What I've named 3 or 4 different sources already. What's the pathology we're trying to examine? What's the research paradigm?
Right. Wild. And so do you think that with the usage of, PRP stem cells, that we're still very early in kind of where those different fields are going? Where do you see these different fields going, if anywhere?
Yeah, it's wonderful to think that you can regenerate tissue, and it's very early, extremely early, and we need good studies. We need the quality evidence to be able to say that, because I mentioned the placebo effect. There's, when you're paying lots of money, you want to believe that it's going to work as well. So it needs to be evaluated. We're still very early. I'm hopeful that we'll be able to find the right stem cell for the right tissue we're trying to regenerate in the right patient population with the right elements. Mm-hmm. And I think we're going to find that, which comes back to your world and my world, that these are adjuncts. These are additional things you can do, but still weight control,
right,
quality strengthening, and general activity are probably going to be the pillars of getting better. And this other stuff is not a magic bullet.
Right. I feel like all these different health interventions, we always end up back with the different, I'm going to call it a treatment, fitness, nutrition, all those different things, stress management. We always end up back there. But arguably probably the hardest one to actually do, right? Because it takes time, it takes effort, it takes research on somebody's own time to figure this stuff out. But somehow we always end up back there.
Yep. For every one study that shows that PRP, for example, works, we've got 100 that show that weight control, exercise, and general and specific strengthening are better.
Right. Okay. And I've got two final questions for you, and then we'll start wrapping this up. And one of them was, so I put a little video on my Instagram story today asking for questions about any of these different treatments or modalities. And a nice lady had a question about stem cells. And more specifically, she had a question about a certain product that she started trying. And I won't name the product or anything like that, but essentially what it is it's a face mask that says that it's derived from stem cells. There's something HAS is what they were using it for. But do different products like face masks or whatever, different things like that, if they're derived from things like stem cells or stuff like that, is there anything behind that, or same thing, it comes back to just not really having enough research at that point?
Yeah, I think cosmetic dermatology is another area where PRP and stem cells are really taking off because people are willing to pay money for that. So that's good in some ways because it drives experience and drives need, I guess. But you're trying to, with the skin, you're trying to accelerate the regeneration that we all have going on, and there are probably 20 different techniques to do that, and I'm imagining that's probably one of them. They're trying to use those stem cells to stimulate advanced, you get fresher skin coming to the surface and this regeneration of collagen and so forth. I'm not familiar with it, but I imagine that's where that question was going.
Right. Okay. And I've got one last question, and it's a big question. And so between PRP, the cartilage regeneration, and stem cell, which one are you going to use to heal that hand? Can you show the hand?
This is good old fashioned vitamin D that every Canadian should be taking between November and April, and not smoking is another way to heal fractures better.
Right.
So again, comes down to some pretty basic some basic things. So.
Right. Well, I think that's a pretty good place to end it. So thank you, Dr. Tim, for joining us today.
Thanks.
This is Dr. Tim from Higher Ground Health Club right here in Toronto, and I'm looking forward to having you on for season 3 next time.
Much appreciated.
All right. Thanks, Dr. Tim.
Thank you.
Now, we hope you enjoyed part 1 of this exciting 8-part series. And if you liked that episode, please give us a follow wherever you listen to your podcast so you never have to miss another episode again. Until next week, this is the